Well, hey, everybody, welcome back to the Early Childhood Chats podcast. Andy Roszak with you today, coming to you from Portland, Oregon, here at the National Indian Child Care Association Conference, or NICCA, as we like to say. And here with our good friend Mariah. Hello, hello. Welcome to the podcast. Mariah is with NECPA, the National Early Childhood Program Accreditation.
Yes, that's correct.
Right.
Yes.
So we're talking all things about, quality. We're talking about really raising the bar in early childhood. And of course, a big part of that is credentialing, accreditation.
Exactly.
All that kind of good stuff.
Yeah.
So what is NECPA up to nowadays?
So the National Early Childhood Program Accreditation, or NECPA, is an accrediting body similar to many that I'm sure you've heard of, like NACE or NAFCC. What we do is focusing on quality and excellence. Our standards are based off of research. They're research-based through the National Academy of Pediatrics, the National Public Health Association, and through those organizations, that's what we built our standards on. And so when someone wants to pursue accreditation, and the reasons for pursuing accreditation are, one, you want to have the most quality program. When families are looking for childcare, what you want is a program that has credentialed staff, credentialed directors and teachers, and a program that upholds quality and is living accreditation. Now, when we say living accreditation, we mean you are managing your program with staff that are all aligned, that you have a good relationship with the families, admin, and families, and with the community as well, and that you're following proper health and safety protocol to create a very safe environment for children to be living in. Now, I guess you could say that being accredited isn't necessarily like top priority for some people when they think about like the price that's associated with it. We are not only incredibly competitive when it comes to pricing, but a lot of states actually provide scholarships, or if you talk to licensing, will also give you different incentives for being accredited. And I feel like that is pretty awesome depending on where you're living.
Well, that's pretty fantastic. We're always about trying to lift up the programs, making sure that it is not just accessible childcare,
Right.
but quality childcare as well.
Exactly.
And I think that is really, really important in today's age.
Absolutely.
So you've got a whole bunch of different offerings I know that you guys offer. You work with, childcare staff, you work with administrators, you work with program-wide initiatives.
Yeah.
Can you kind of talk us through some of those different levels of accreditation that you do offer?
Okay, so in terms of levels of accreditation, really one of them is just like, going through self-study. And then the other aspect, and that's for the entire program. Then in terms of credentialing, we offer a director's credential. So the National Administrator Credential is or the NAC as we call it, that is for professionals. And unlike some other types of credentialing, it follows the person and not the program. So we understand that people don't always stay at the same program forever, but it's for you specifically. Likewise with the Certified Childcare Professional or the CCP, that is for educators. And again, it's just a way to take pride in the work that you do because it is so important in this industry. And I think it should be something that's valued and taken into someone's hands specifically. And then our partner organization, our sister organization, is the National Child Care Association. And that focuses a lot on advocacy, which we know is so necessary, both federally and, encouraging people and empowering educators to focus on state advocacy as well.
So you think about all the different professions that are out there, and you use the term professions, right?
Exactly.
I mean, because profession means some kind of a credential, some kind of a check, some kind of a educational standard that we're up to. And gosh, you think about, pharmacists and plumbers and lawyers and even nurses, paramedics, doctors, everybody's kind of accredited to some degree or another. Making this push into early childhood, I think makes some sense.
Absolutely.
And I know a lot of different states have tried different things. I'm in Washington, D.C., looking at bachelor's degrees and all of this kind of stuff. But what is kind of the elevator pitch here? Why, as a child care professional, should I care about this? Why is it important to me? What's it going to do for me personally? And then probably most important, what's it going to do for those kids that I'm interacting with every single day?
Exactly. No, that's a great point. you want the people who are interacting with your children every single day to be the most highly qualified individuals. And I think one of the highlights of our credentials that we offer is that you don't necessarily have to have a bachelor's. There are other ways for you to show that you are credentialed that will add up to that. So we don't like to put restrictions around what makes someone a qualified professional. Of course, there are those, little check marks that have to be ticked off, but formal 4-year college doesn't necessarily have to be part of that. And we pride ourselves on being a provider and educator focused organization, and giving people the options to be credentialed and go into high quality and make that one of the top priorities in their life and make it their way.
So how are we doing across the country? Are folks signing up? What is the numbers looking like? I'm hoping it's up.
It absolutely is, actually. And we recently, did a little assessment, and we actually have roughly 1,000 programs that are nationally accredited through the National Early Childhood Program Accreditation. And we have about 500 programs that are actually currently going through self-study. So yeah, we're pretty up. So if you want to be cream of the crop, I mean, it's not necessarily with us at all. We encourage accreditation and certifications in every form, wherever, makes sense for you, makes sense for your time, for your budget, for your program. But we definitely are very provider focused, and we love to make ourselves accessible in any way, shape, or form, to make sure that everyone has access.
Sometimes you get the critique, not of you, but of other programs saying, gosh, this is so, what do I want to say? It's basically so educational or so Ivy Tower driven. You've got people that are writing curriculum or saying you got to do A, B, and C to be proficient or be an expert when they're not even working in the field.
Right, exactly.
Now, I know that you all take a different approach, and a lot of the work that you do is actually driven by boots on the ground,
It
people
is,
doing
yeah.
the work. And can you talk a little bit about kind of how it transforms your approach to this and how it really influences, hey, if you're going to do this curriculum with us and be accredited, you're going to do A, B, and C, but A, B, and C is being done because the people in the field say this is the best path forward here, right?
Right.
It's really evidence-based, I guess is what I'm trying to say.
It is. It is evidence and research-based, and we do have a very grassroots approach to all aspects. We like to call it total program quality, having accreditation and 2 different credentials, as well as national advocacy. And we don't want anyone to ever feel like they're being written off. So again, we have research-based, evidence-based, protocol. And we think that everyone should be able to have the opportunity to pursue accreditation and the highest amount of quality in a way that is easily accessible to everyone, no matter where you are nationally.
And the curriculum itself, are folks doing this in person? Are they doing it online? Is it a hybrid? How does that kind of look and roll out?
So both of our credentials are actually online, which is super wonderful, because as you can kind of pace yourself. And usually I think we have about 2 years that you have the space of time to go ahead and go through these credentials. So no one's rushing you. Obviously there are deadlines. We don't want anyone to, start their process and then, fall off. But if you do, we're always there to help you, get back in and, just see how we can help you along in the process. And that goes for self-study through accreditation as well. The self-study process, you have 2 years to go ahead and go through that before you request your visit. And we think that that's probably one of the things that sets us apart, trying to make sure that everyone gets to go through their own process in a pace that works best for them.
And obviously you're here at the conference this week spreading the word about the programs that you offer. But I've also heard in some states and in some locations, there might be some subsidies or some financial assistance or something like that. Can you talk a little bit about what that looks like?
Absolutely. I mean, state by state, of course, looks different for most things. But I know specifically, working with programs in the state of Indiana, I know that they offer a lot of funding options, and will actually pay for, when it comes to accreditation, we'll actually fully fund every aspect of it, from self-study, requesting your visit, to the annual, to the annual reports that you have to do. So that is wonderful. I know in Florida, where we have an abundance of accredited programs, Florida actually offers a lot of tax credits if you are accredited, as well as I'm pretty sure, I'm thinking of New Mexico, I think there are also a lot of options there as well. But again, they do go state to state, and you should definitely check with your license, childcare departments and see what they're offering in terms of scholarships or in terms of, just kind of getting you the funds that you need to reach quality.
So what do you think are the biggest barriers to entry? Is it people don't know about this program? People are too busy? People think it costs too much? All the above? What are the barriers to entry here?
I would say definitely cost is one of the things that I think might be a deterrent. Again, we are incredibly competitive in our pricing, but I think more than anything, a lot of people don't realize that half of the things that they're already doing is actually you're already done more than half the work to be accredited. So you're really kind of scaring yourself away from it, or thinking that you're not capable, and it's not true. If you take the time to reach out to us, talk to us, visit our website, you're already doing the work. So it's really just a hop and a skip. So don't be deterred. Definitely give it a try.
Well, it's been so interesting over the years. You've heard a lot of work and emphasis in the quality stuff,
Mhm.
right? Quality rating systems, and everybody's going to be quality. And unfortunately, we haven't, generally speaking, broad brush speaking, we haven't seen the financial support to go along with that.
Right.
And we often think of early childhood education as one continuum,
Right.
but we know there's a lot of disparity between religious-based and family childcare based, and our Head Start programs, and our for-profit childcare programs, and our not-for-profit. I mean,
There's a lot.
there's a lot of different disparities. So who is kind of, and of course, the tribal programs who we're here
Right.
with this week,
Absolutely.
who is really the target audience for this? Is this for everybody? Is this for a certain segment? Who are
Yeah.
you really looking at here?
So we are for everybody. And we know that there are other organizations who, you can go to, but we are for licensed homes care programs. We are for the big centers, the ones that have multi-sites. We are for the smaller Christian private programs as well. We don't discriminate at all. We want everyone to be able to have access to quality, whatever it looks like for them, again. And again, it's evidence-based standards. So we don't want anyone to feel left out. If you want to pursue quality, we are here for you.
And can you talk a little bit about kind of how the process works? Is this going to be a lot of like online videos? Is it reading books? Is it working with peers, discussion boards? Like what is kind of the process holistically look like?
Okay, so for accreditation, the process begins with you simply expressing interest. You go online, you enroll. Then once you do, we will send you our self-assessment instrument along with our standards and resource guide in a folder that's full of goodies to help walk you through, and a kind of a general timeline of what it looks like to go through the NECPA process. Once you begin that, we are here for you. If you want us to, take some time to kind of go through the standards with you, we're happy to do that. We're happy to set up calls. So it's not like you're alone at all. We don't want anyone to feel like you've been deserted, but it is largely a self-led process. So you will go through the standards with a director and their staff go through all that together. And again, you have 2 years to do that. And you can take a year or you can take 6 months, whatever, works best for you. But it is mostly you. But we're here. You can always fall back on us. And when it comes to our credentials, you will have a live person who will be doing those trainings for you. So you're not alone. And in every time you submit an assignment, those are graded by a real person. So we're not
No AI.
no AI. We're no AI. I mean,
Okay,
AI is
good.
helpful, but we like to be very, very people forward. So that goes for all of our credentials, and as well as for advocacy, we are an open door.
Well, certainly advocacy is top of the list. And I know here at the conference this week, again, we're in Portland, Oregon,
Right.
National Indian Child Care Association Conference here, had just a wonderful turnout. I mean, probably
I think there's like
200,
200.
300 people.
Yeah, for
It's
sure.
rocking and rolling here. So a lot of the themes we're hearing about, advocacy is right up there.
Mhm.
And I think, obviously there's an election year,
Yep.
and it's top of mind with funding and what are we going to
Absolutely.
do and what are we not going to do and all that. So how is kind of the role of advocacy play into all the work that you guys are doing?
So we focus a lot on making those connections with state associations. We are a national association, but we want to make sure that everyone's messaging is together. One unified message. Contact your legislators. Contact anyone in your industry who isn't really talking too much about it, because it's everyone's problem. Realistically, it's not just childcare. It's the workforce as a whole, and many people don't realize that. So parents, educators are all advocates. You don't have to have a specific profession to be a childcare advocate. And so we want to make sure that the messaging is, just as a whole in order and all together. We are trying to organize more national get-togethers so that, they realize that we're here and we're not going anywhere, and funding is necessary in order to keep it going. And it's not just for people to have jobs, but it's for people who are not in childcare to actually be able to go to work. Families need childcare, and children need a safe environment to learn and to grow while their parents are at work.
And certainly speaking to the choir here on the podcast, but I mean, I think we all have seen the facts and figures. About 20% of a family's income can be going to childcare. I mean, it's
Exactly.
a massive chunk of your pocketbook, isn't it? So
It is.
having that unified message, which, look, in complete transparency, we haven't been all that good at over the years.
Unfortunately, no.
And, our industry is a little bit fragmented, again, just because of all the different players we have. But I'm hoping that people start to understand, like, hey, now's the time to really get our act together.
Exactly.
And I applaud the efforts that you all are doing. And of course, groups like the Strolling Thunder and all that kind of stuff, which, I worked on Capitol Hill many years in the United States Senate, writing policy, and meeting with constituents. And I got to tell you, having your house in order makes a tremendous amount of difference, right? Because if you don't know what you're asking for,
how are they? Exactly.
100%. So it's exciting to see a lot of the groups kind of coalescing together. You see that to some degree with an election year, but I really hope this is going to be sustaining longer.
Jumping off point.
I do think we had pretty good momentum, and then of course, like everything, COVID kind of put a damper in the plans.
Kind of COVID showed, just how important childcare really is. I think it opened a lot of eyes, especially when it came to, revolving doors when it comes to, staffing and those issues, and parents being able to have a safe place for their children.
Yeah.
So COVID was definitely a curse, but I think that we can use that as an example of why it's so important.
Well, and to that vein, I mean, it doesn't hurt to remind people that we are and were essential workers.
Exactly.
Look, if
Essential
there's
industry.
no childcare, the parents can't go to work, and
Yeah.
economy can't boom, and all of that. So I do think refining those, really core messages is important. And again, I just applaud the work that you all are doing beside the accreditation piece too. Tell me a little bit about the success story. I want to hear about, people that have went through the program, and as a result, now they're able to do A, B, or C because of the lessons they've learned and the accreditation they've gained and all the knowledge they've gained.
I feel like there's nothing that's super jumping out at me. Although
Totally putting you on the
I
spot.
know, but I can say that we have had so many programs, directors specifically, who have personally just kind of sung our praises, not to brag, but have sung our praises
Brag, it's okay.
on just how we are with our communication with our programs, and how they actually feel, at ease, because we don't believe in gotcha accreditation. We want everyone to feel like they are empowered with all the tools. And I feel like it's just really nice to feel that people who originally thought that this was something so big and so scary feel comfortable. And so that is one of the things that I feel like is a huge win, just feeling like you're doing good work and people feel supported, because that's what it's all about realistically. And then also, I feel like any programs who have gone through like Child Care Aware of America, because if you're an accredited program, working with CCAOA for military fee assistance is huge. And those programs, we've had great success with them where they've been able to go forward and, provide quality care to those military families. So I believe that that's probably a huge win for us as well.
That is a huge win. So personally, what do you find most rewarding about this job?
Personally, just like people. And I really love my team. I love the idea that I get to travel really awesome places like Portland, Oregon, and make new friends like Andy. So yeah, I think that that's probably the most rewarding part, and just getting to spread the word, and also just, you know, having fun in general. I think it's so fun to be able to talk to people about their options and make sure that it's not something that is they shy away from. So
And you have a team that's largely headquartered in the Washington, D.C. area,
yes,
but obviously you do
exactly.
work all across the country.
Yes.
What's the best way to find out more, reach out to people? Would you recommend the website, or how would people kind of enter into your world here?
I would say first things first, definitely check out our website. So it's www.necpa.net. And from there, you can also learn all about what we offer, but also going to the National Child Care Association website, which is www.nationalchildcare.org. You can learn all about advocacy. A lot of our pre-recorded webinars are there for your continuing education needs. You can earn an hour of PD going and reviewing those webinars. So definitely do that. And I would say if you have any additional questions, if nothing's clear to you, we do have an awesome support bot on the website, but feel free to email us at ncca@ncca.net.
Well, fantastic, and pretty active on social media, I will say,
Yes,
right?
yes,
So-
actually, that's me too. I love, I'm responsible for our socials. So yeah, we're pretty active. You can hit us up on Instagram, and then also on Facebook and LinkedIn. So
Well, there you go. And just to be 100% clear, there is no kind of cohort, there is no kind of deadlines, and you can kind of enter into the system at any point you
that's
want,
correct.
right?
At
So
any point. Yeah.
no real enrollment deadlines. It's not like
No enrollment
registering in
deadlines.
college or something here, so.
Exactly. Whenever you're ready, we're here for you.
Well, fantastic. I know you had a whole bunch of notes that I
I
wanted to make sure we
did.
covered. Did we miss anything?
We actually didn't. You asked all of the
Oh,
questions,
good.
so I
Well,
feel very well prepared.
I try. Well, thank you for being here so much,
Thank you.
and thank you everybody for listening. Hope you enjoyed this, and certainly this is something that I don't think is going to go away.
No, it
I
won't.
think, you know, if
So
anything, it's probably going to become more and more, and
I agree.
you know, we'll see what the funding and everything looks like. But you could certainly envision a time in the future where it's mandated that you become accredited, I would
Yeah.
think, right? I mean, I don't think that's out of the realm of responsibility or
No.
possibility.
No,
So
absolutely not.
encourage you to take a look at it. Quality is key.
Quality is
And,
key.
we appreciate you being here. We'll have more from the National Indian Child Care Association Conference here in Portland, Oregon. But for now, say thank you to Mariah, and thank you so much for listening. We'll be back soon with some more episodes.